Hello, my name is Dr. Bonnie Key, and I'm the Founders Associate Professor of Cardio-Oncology and Director of the Penn Cardio-Oncology Translational Center of Excellence at the University of Pennsylvania, and I have the privilege of serving as Editor-in-Chief of JACC Cardio-Oncology. I'm here today with my mentor, Dr. Valentin Fuster, who is Editor-in-Chief of the Journal of the American College of Cardiology, and also Physician-in-Chief at Mount Sinai Hospital, and Director of the Zena and Michael Weiner Cardiovascular Institute and Marie and Josie and Henry Kravis Center for Cardiovascular Health. Dr. Fuster is also an internationally recognized expert in atherosclerotic cardiovascular disease as well as cardiovascular disease prevention. Dr. Fuster, thank you so much for joining me today on this one-year anniversary of the first issue of JACC Cardio-Oncology.
Well, thank you very much. I have to congratulate you. This should be the first thing. 1 year of success.
Thanks so much, Dr. Fuster. That means a great deal to me. And you know, and I've said this many times before, that it has absolutely been a community effort, not achievable without the mentorship of so many like yourself, as well as the great efforts of the communities of cardiology and oncology. Have been tremendously supportive and really inspiring to me. I wanted to have you share with our community your initial vision that you set forth many years ago now about launching a JACC subspecialty journal in the area of cardio-oncology. Can you tell us a little bit about what you were thinking years ago?
Well, I am surprised this didn't happen before, and you have to be congratulated by really being a pioneer. First of all, I have to say to those who are listening why you are the Editor-in-Chief of Cardio-Oncology, and your track record is fantastic. Particularly what was very appealing to us when we interview the different people and candidates was your scientific rigor and your background. And I think this is very important that at least everybody should know from the first minute of our conversation, and that is you are the right person to lead that journal. Well, yeah, I will tell you my feelings is that over the years, we, in the cardiovascular field, when we deal with oncology, it seems it's always the same thing. How is the ejection fraction? We are giving this new chemotherapeutic agent and may affect ejection fraction. And then we started with echo, and then we moved with MRI to be more accurate and so forth. And I was thinking, this is very, very narrow thinking. There are so many things that actually integrate the cardiovascular system in oncology. First of all, look the number of factors that we share that produce both diseases. And it's not just the smoking and many other things, as you know, that really have an impact on us, the environment, many things. So that's the first thing to take into account. The second is, as the cardiovascular field has advanced at the molecular and at the genetic level, it is fascinating that many of the pathways are the same pathways that we are actually dealing with cancer. For example, now I am personally working on a project that has to do with the number of aspects of cells that are actually generated in the bone marrow. And as you know, these cells can actually lead to vascular disease and at the same time to all sorts of lymphomas, leukemias, and so forth. So even the biology, but there is something else. Now there is a shift from disease to health. And I think we all are in agreement that prevention today or the issue of enhancing health is actually cost effective and is the way we should do. Now, why we don't work together? If we have to prevent cardiovascular disease, is the number one killer? Maybe cancer is the number one killer. Who cares? But here we have the two diseases that are affecting all of us. And actually, can we work together to early identification of cardiovascular disease and early identification of oncological diseases? All of this was in my mind for 3, 4, or 5 years. Then came the problem. And the problem is, I said, you know what? We should have a journal that gets into cardio-oncology. And people said, are you crazy? I know, we already know about all these toxicities. I said, what is toxic is your head. You really should understand that this is much more than the drugs affecting the heart. And this is how it evolved. And I'm very lucky to be in JACC with other people, other editors of the family, Justin and others who really believe in what we wanted. And then the question was to go and get the right person, and we got it. So that's basically how it all started.
Yeah, thanks so much. That is really inspiring, and you always have a very futuristic and very creative view, and you work towards the greater good of society. And I think that's also what's been so inspiring. And you're absolutely, I should just also comment, you're absolutely right. It's also about the team that we're surrounded with, and their motivation and their confidence in us that help our ideas to be successful. But I'm really excited to hear about your research that you're undertaking. That's terrific, and also your model prevention has been a model for us all. You know.
Yeah, well, it's very important. I think we have to address health today, and certainly to me there are three areas that are important. One is oncology, the other is cardiovascular, and the other is neuropsychology. The issue of the brain, and I think we have to really move as a team on all of these. And what is quite appealing to me dealing with cardio-oncology is we are a team of people that are all interested in really actually to work together. But I have to ask you a question though. How do you feel working with the oncologists? Do you feel that they are somehow a little bit cautious who we are, or is the opposite? What is your feeling? After 1 year, you are dealing with the real community, the people who like to read and to write and so forth. Tell us your view about that.
Yeah, thanks so much, Dr. Fuster, for asking that question. It's been phenomenal to work with the oncologists, and I can speak to that on a number of levels. So I've been active in cardio-oncology and built a cardio-oncology research program at Penn since the 2009, 2008 or so. And that's when I started working hand in hand and side by side with the oncologists in terms of building these longitudinal prospective cohort studies of cancer patients being exposed to different cardiotoxic therapies and following them over time. And it's been a wonderful experience because what I found is they want someone to care about these problems, cardiovascular problems that can plague patients and that can affect the safe delivery of necessary cancer therapy. So through that experience, I really learned to develop a really great partnership, and I feel so indebted to my collaborators in oncology who helped me launch my research program. I'd also say that the oncologists, we work very closely in terms of our editorial board. Our associate editor team is about half and half, oncologists and cardiologists. Yeah, and our deputy editors, it's one oncologist, Armenian, and one cardiologist, Dan Lenihan. And for the AEs, it's also equally split. And they have been phenomenal. And a lot of times when we discuss these papers, you need both perspectives in order to understand the true clinical context and also the significance of the topic. So it's been a lot of fun. I also work with oncologists closely in the NCI ECOG Akron research group, and they've also been very, very receptive. Again, they want someone to care about these problems because cancer patients can be extremely complicated. So many issues going on, not just the cancer itself, but then all these other
Absolutely. I am impressed by the way you are running the journal. You have state-of-the-art points of view, your presentation of cases. I think is a very good, in a way, is a challenge, but you are making it because you're really getting into different audiences here. And this is what I'd like to ask you. I remember when you took over the journal, you were very nervous about one thing, and you were saying, I am going to make it. Remember you told me. And I said, look, we always started something, and we always have the same question. Are we going to make it? But I am convinced this is going to flourish. this integration of people dealing with human beings and with disease, we are going to be more and more integrated. And I think it's the experience of all of us that when we work with somebody else who is an expert in a field, we feel like much more confident into what we do. So I can imagine now being a cardiovascular specialist and dealing with a patient who has cancer, as many patients we have, and knowing that I can call somebody that really understands and shares with me, and we have, this is fantastic, the team effort that is evolving. And I think your journal can really help this very much.
Absolutely. You can call me anytime you have a question. I'd be happy to help and
I have
chime
many
in.
questions. Yeah, I have many questions actually. Sure.
Yeah. I wanted to ask you also, you've been at the helm of JACC now a number of years, and we've all been inspired by your leadership, your tireless dedication, again, your creative thinking, you're thinking outside the box, and you're always pushing us to advance the fields. So what do you think, to shed some wisdom to all of us, is one of the most valuable lessons you've learned as the JACC editor-in-chief over the past number of years about what we need to do as within the field of cardio-oncology to continue to advance our science, care of our patients, which is really what drives us, and the journal, and what do we need to do to advance the fields of cardiology and oncology?
Well, first of all, it may be, I would have first to be humble. One of the things that you learn is not to say how little we know, but be sure that we don't think we know a lot. Because here is a situation that, in being an editor-in-chief of a journal, you realize with all the papers coming in that really the fields are evolving. And I say to myself, but people have the time to really read and to know what's going on here. So the first thing is to be humble and ready to be educated. And I'm the first one that I'm in the front line of this, to be educated. So I think this is one thing that I learned. Science is advancing very rapidly, and we have to be up to date in order to treat our patients the best. That's number one. Number two, what I have learned is the world is moving very rapidly. It's not just science, as we discussed, but even how people get educated. And one of the things that I'm learning more and more is we have to be very perceptive of what the young people want. I mean, all ages, but particularly the young people coming up. Are they reading the journals? And I'm learning lots of things. For example, one of the things that I learned is that about 90% of the young people who get into a journal, let's say JACC, the first thing they do is they read just the conclusion of an abstract. In about 50%, they don't pass by the conclusion. That's a stop. Okay? There's another group that goes a little beyond and go to the central figure. That's why I developed the central figure.
Yeah.
Is to be simple and be able to portray in a very simple way a concept. And actually, there are very few who would actually go to the actual paper in itself. And this led me to develop the podcast. The reason why I got so involved with the podcast, which, by the way, is, well, it takes a lot of time. I mean, my wife knows very well what the podcast for JACC, because, I do a podcast of every article, and it takes a lot of time. But you know what? I feel happy about it. I am not asking more than being capable to say, I'm educating some people. We have 200,000 every month of downloads, and we are reaching 10 million now.
That's
so
amazing.
we have to learn. Before, I never had any idea that I would end up doing podcasts like this. So we have to move, like the cases that you present and so forth. We have to learn what people want and really listen to them rather than criticizing them. The moment I learned that the young people get into an abstract and lead the conclusion, I said, how frustrating. But then I say, better you change and you make it more palatable. So we have to move. So the second aspect I wanted to tell you, the first was humility. The second is to really go along with new ways of education, because this is the real impact of a journal. And number three is very interesting, is about what do you publish? And here you need to have a very clear idea, what is your goal? And I can give you several goals of journals. And I will tell you the one I picked up. One goal of journals is impact factor. There are people who don't know to talk about anything at impact factor. Then the question is, where the impact factor goes? Certainly goes to 5% of the cardiovascular community who writes papers. They look at the right impact factor to where to send that paper. I think this is fantastic, and we should continue to be aware of that, because this makes our journals to be on the top. But on the other hand, is this your goal? What about the 95% of the rest of the people who like to be educated? What do you do? So I think that you have to have very clear idea of what you want. And frankly, my objective is to have impact in the cardiovascular community. I don't have any other objective. Now, I like to have a high impact factor for the guys who write the papers come in. But on the other hand, I like to have an audio system or a podcast system that can educate many people who actually don't write papers and are very good physicians and doctors. So I think that the 3 points I wanted to tell you, if I have to summarize or answer your question, first, be humble. Changes are so rapidly happening that better we are educated. And then the second issue is the ones we are really talking about, is the impact factor is one way to do it. But certainly, I don't think it's necessary to be focused only on that, and it's who is our audience. That's the second. And the third is, what method do you use to make your audience and the people really knowing what you try to portray in these journals? These are, to me, the three main aspects that I try to, at least to move forward. Are very simple.
Yeah, no, those are excellent guiding principles, and I wholly agree with them. Humility is key, undoubtedly, and being adaptable and meeting your community where they need to be met. And I think ultimately we all seek to have impact for the field, impact for the science, and impact, most importantly, on our patients, so we can take better care of them.
I feel so proud. I have to tell you, I feel so proud that we were able to launch this journal, CardioOncology. I mean, it's fantastic. Two critical diseases today that we face every day. Can we pull them together, please? I don't know why this was not done before.
Yeah. No, well, Dr. Fuster, I have to really say thank you, an earnest and very sincere thank you to you for your vision and for all of your tremendous support.
Look, thank you very much. I think I want to, perhaps we conclude this discussion by saying that we all feel very proud for you to be the editor-in-chief of CardioOncology. And I have to tell you, you are doing a fantastic job, very challenging job, because you started from zero. And you know what? All of us have started something from zero, but all of us remember how difficult it is to move up. And then it becomes exponential. And as I told you, I think when you met me for the first time, I said, look, wait for a year or two. Don't try to rush. It will come. And now you are beginning to be exponential already. So congratulations.
Thank you so much. Thank you, Dr. Fuster. And thank you to the community of JACC CardioOncology for your tremendous support. Thanks.
Well, thank you very much, Bonnie. It's a pleasure to be talking with you and to celebrate this first year of a fantastic success. One thing I made a mistake. I didn't bring a bottle of champagne here to celebrate it, but maybe next time. This virtual thing is preventing us to do lots of good things, isn't it? Okay. Anyway, look, thanks very much, and I appreciate your confidence, and we have full of confidence in you. It's very exciting to work with you. Thank you.
Thank you. Thanks.